Stars, so many people struggle with the surprise health issues that can lead you to hospitalization and surgery. I have a good friend who I work with who was telling me that she spent much of the last year having lady part problems that put her in the hospital for very serious surgery, and she's still bouncing back. She lost a ton of weight, but thankfully, she's healthy and she's been able to be involved in, some of the labor actions that were going on in Hollywood in recent months. But I think that, certain kinds of news have led people to think about, like, wow, what kind of abdominal stomach surgery could lead you to hospitalization and recovery for quite that long, right? People who've gone through cesarean, who've gone through, different kinds of issues, and certainly there are folks who, aren't even necessarily women, that certain kinds of viral infections can lead to cancer and tissue removal and parts of, whether it's the cervix that can be affected or the, kind of backyard areas and intestines. And all of that can lead to having a need for colon resection. It could be Crohn's disease. But people can end up with a colostomy or ileostomy bag. The difference being that the ileostomy is when they reroute a section of your small intestine through your abdomen, right? So that there's a way that you can eliminate waste without it going all the way out into the backyard. It just comes out through the stomach through something called a stoma. And if it's the large intestine that's rerouted through the abdomen, then that is a colostomy. And it kind of works with a ring and a bag. And there's actually, surprisingly, a lot of content on this platform and others about it. And, how people, kind of make an adjustment in order to survive, right? There are certain celebrities who were affected by, shall we say, backyard cancer, who because of the optics of having an ileostomy or a colostomy bag, they refused to have the surgery and lost their lives. And that's never what we want to do. Not over vanity, not over the adjustment, right? Like, you can adjust. You can, get help to adjust, but these are real things that happen to real people. I have a friend very young, not even 30, who thought that he would, get down with the go-round, right? There's certain things you can get involved with here socially where, your body is in the mix with strangers, right? I have a few friends that do this, and it kind of becomes a social thing, a social climbing thing, certain private clubs, certain, you can work in production and get invited to such events. I've had, girlfriends of mine try to get me to go with them to such events so that they could, get with Army Hammer or, whatever celebrity they thought was going to be at these events. And I said, yeah, okay, if you need me to, I'll go. I'm glad I didn't go, for various reasons, whether it's, again, a dietary restriction because if you have a wheat or gluten sensitivity, or if it's something virus related, it can lead to just critical need for medical interventions, and it can change your whole lifestyle. So this woman wrote a blog many years ago that I thought was very, very compelling. It's a blog for those getting used to life with a stoma, which, again, if you just search that word here on this platform, you can find a lot of, images and people and content. People will show you what it is. But accepting my ileostomy bag after living with a dietary restriction. Living with a bag on my stomach was something I did not believe I could deal with at first, not just because of how it looked, how it felt, or because I was scared of other people's reactions, but because I didn't know what kind of emotional effect it would have on me. I didn't know if it would pull me back to where I was almost 4 years ago when I was living with a dietary restriction. I was scared it would bring back those same feelings, that obsessive, compulsive feeling of loneliness that I felt through lack of self-control. In 2011, I was admitted to hospital after one of my lungs had collapsed due to vomit being stuck in my chest. Nobody knew I suffered with an eating restriction at this time. Nobody would have guessed either, nor taken me seriously. I wasn't skinny, I wasn't ill-looking, I was a normal size, just normal. People forget to differentiate between eating restrictions of different kinds. Eating restrictions for me didn't just revolve around body image. Of course, that was my aim, but for me, it wasn't just about restricting. It was about binge eating and correcting the overeating. Eating so much that I'd feel sick, trying to fill the emptiness inside of me, and then making up for it any way I could. Paraphrasing. If I couldn't control myself around my dietary restriction, I needed to make sure it didn't affect my body image, making sure I was back to the controlled image. Because if I felt controlled, I couldn't lose that body image. I couldn't be angry at myself for losing control again. That empty feeling gave me back this sense of control I lost every time I violated my dietary restriction. I remember coming out about my fight with it in 2012. I made a video for the blog I was writing. I talked about the effects it had on my body, my family, and my social life. Of course, many people wrote to me and congratulated me on speaking out about it. Others wished me well. Lots of people that had known me in person had seen me in full length and had not taken the time to look deeper. They judged me, they mocked me, and attacked me for, quote, talking about something I knew nothing about, unquote. I could not deal with knowing that people were talking about my experience in such a negative way. I deleted the video a few weeks later. I had never felt so alone. Luckily, I had a couple of close friends at the time that knew what had happened and were there for me. But it didn't stop me being scared of what others were saying. Feeling people were looking at me when I went out. I felt like I couldn't talk to anyone. I felt like people would just laugh at me if I tried. I continued to struggle even after the video, after my hospital recovery, because I still felt alone. I was made to feel embarrassed for what I had gone through, and nobody should be made to feel like that. It wasn't until I met my boyfriend that things began to change for me. Living with eating restriction is one of the loneliest experiences I have had in life. My life revolved around my eating restriction, weighing myself daily, adjusting my eating, and looking in the mirror and seeing nothing but ugliness. I felt an aching need to change. I needed to conform to body image. That way I'd like myself more. I'd feel better. I hid this from my family and my friends for 2 years. I don't know how I kept it up. It was ruining me. I'd cry every night, feeling overwhelmed with guilt from the amount of dietary restriction that I carried out just moments before. I was scared I'd never like myself. I was scared it would never stop. And this is how I first felt with my bag. I was scared of being scared. I was terrified I'd hate myself again. After not dietary controlling since the promise I'd made to my boyfriend in 2013, I had been free. I didn't want to go back to feeling trapped. The first 2 weeks with my ileostomy bag were kept secret. I didn't tell anyone. When people asked why I had been in hospital for so long, I avoided it. I told them I just had a little surgery. I was scared of that judgment I experienced those few years ago, but dealing with it on my own was not dealing with it at all. I was ignoring it. It was singling myself out amongst other people my age. Why should I hide my scars? Why should I be ashamed of the bag that saved my life? Why should I be afraid of other people's judgment? I decided to speak out, and I'm glad I did. It has allowed me to accept what has happened. Writing has become my therapy. it has been an escape. It has also turned into such a positive